At the heart of it, this work lies at the core of our mission at Common Spirit Health, to improve the health of those we serve, especially the vulnerable. And so it really starts as a mission-driven, mission-aligned initiative. At Common Spirit, we believe that really health is a common thread that runs through our communities, and that everyone's entitled to a healthy life. So if we can help to build healthier communities, more resilient communities, that's part of what we're really working on. We believe that through the community investment program and the other things that we're doing, that we can be that connective fabric that helps bring the people together so that they can have the more resilient communities. So from a mission point of view, as a key strategy of the organization, community investment fits in, and it's an important part of both who we are and what we hope to do as we serve others.
It was an important consideration for me in the invitation to join the board that Trinity Health has this as a part of its portfolio, that it recognizes the potential to leverage the substantial investment portfolio that many hospitals and health systems have to help support, accelerate, and scale efforts to address the real drivers of poor health, what we now call the social determinants of health, what within Trinity we call the social influencers of health in our communities. So looking at strategic ways in which we can support the community development community in targeting investments in areas such as affordable housing, healthy food financing, small business development, and general efforts to support the advancement of communities that are substantially negatively impacted by historical prejudice, as well as a number of other ways in which that undermine people's health and well-being in those communities.
As early as the 1980s, the organizations that have come together to make up Common Spirit Health have been investing capital in the communities, really to address issues of equity. What the organizations found was, as a trusted anchor institution in the community, that if they would make investments in various projects that would attract other potential investors in the community, would amplify both the size and the potential impact of the project. It's important when beginning the work to really understand the community and the community's needs. So we like to think that listening is really the first part of that. As part of that, it's important to listen across the entire community and be sure you're listening to all the voices, including some of the voices that might not be heard otherwise. So that really leads to wanting to be sure that the partners, the boards of those partners in that diversity ought to be one of the things that we're looking for, to be sure that we are hearing from the various populations that are there, the various groups that are impacted. And so, like with all of our board work, I know boards across the country are looking to see how can we be sure we have the right representation, the representation that reflects our community. In this work here, as we're working with individual communities and looking for partners and listening to the community, diversity is a key aspect to think about.
But assuredly, hospitals and health systems, as we begin to assume increasing risk for keeping people out of our emergency rooms and inpatient settings as risk-based reimbursement expands. So one can stand back as a healthcare institution and look at the field and say, well, that's not my job. But it is both irresponsible and it also, from a leadership perspective, reflects a lack of forward thinking and acting on behalf of healthcare organizations to not be engaged in this arena. Now, again, I'm not suggesting that these are problems that hospitals and health systems should solve on their own, but in each and every community across the country, hospitals are often the largest employers, and they're in a unique position to use their voice in a powerful way to help drive these kinds of conversations.
We know we can't do that alone. one of the great things about the community investment programs that helps to attract partners, and that together, hopefully, we can make that long-term, that sustainable impact that we're hoping for.
The opportunity is now before us that has been heightened by our experience with the COVID pandemic to say and to begin to take a stand on a full spectrum of issues: access to early childhood education, quality of housing, access to affordable, healthy foods, and a livable wage are all direct health impacting issues that we need to address. Our approach to health involves how we better manage the care of populations, what we call healthcare, population health management. How do we effectively and proactively manage the clinical care needs of our populations? How do we step a little further upstream and more proactively address the broader health and social needs of our populations through the development of community information exchanges and the development of closed loop linkages with a broad spectrum of community-based agencies, and where there is a lack of capacity, to look at how to build that capacity. And last but certainly not least, coming to grips with with awareness of the policy and systems and environmental dimensions of health. Trinity Health, I think, like a number of other systems that have some experience, such as Common Spirit Health, in this arena, I think increasingly are looking at how to ensure that both capital and debt, both investments and grants provided to communities and in support of community development are focused in particular in specific subgeographies where health inequities are concentrated, where social and economic inequities are concentrated. And that takes us into both the kind of investment arena that I'm talking about, but also really thinking beyond and making that connection. If we arrive at the fact that we have relatively high rate, for example, of preventable ED and inpatient utilization for children with asthma or people with diabetes, and if we geocode that analysis, this is important work that we do at the Center to Advance Community Health and Equity at the Public Health Institute. We do these kinds of analyses for hospitals and health systems and collaboratives of these stakeholders in communities around the country.
We get reports at the board level and the community level on each project that gives us both progress and impact. And then at the end of the year, we look at the overall portfolio, again, looking for the impact there. I'd like to say that we have all the measures of impact and the direct connection to social determinants of health worked out, but we're still working to find what are the best and most appropriate metrics to show the impact of the work. As a physician, and board member, this is especially gratifying because although we can't always directly link them, to look at a population and see what appears to be the impact on chronic illness and other important social determinants because of some of these investments is, like I say, that's particularly gratifying. And we hope to be able to better measure and quantify those going forward.
There's a particular need for our systems as we think about our boards going forward to ensure that we have the breadth of competencies on the board. People that are positioned to ask the kinds of critical questions that need to be asked. These questions are really strategic. The assumption of financial risk in the reimbursement arena is a real challenge for us as a sector. And we need people on our boards who understand what's happening in the public sector, who understand issues of evaluation and measurement, understand how to work with residents in communities, with community-based organizations, how to build an ethic of shared ownership for health in our communities. And so in that sense, our boards really serve as potentially, rather than as rubber stamps for for more traditional approaches, i.e., let's stay out of those issues, let's really stay in our lane, to beginning to say, how can we begin to use our influence in a more positive way? How can we play a leadership role? Again, it's not our problems to solve on our own, but we have far more power and influence than I think we've effectively used. So our board members really need to begin to ask these kinds of broader questions. And we need to ensure going forward that we have the configuration of board members that are positioned to ask those questions in a thoughtful way.
So it's both an operational functional role that we play, but also I think both a symbolic and a communication role that we play around how this is important. It's also important, I think, to frame this that our community investment program is a part of an overall larger community health roadmap. And so it's one of the tools that we use to address social determinants of health and equity as we try to, again, make not only an impactful a mark in the communities, but also one that's sustainable over time. But we think that the community investment and the sorts of things that we support actually does help to get at that notion of creating a more resilient community through sustainable projects that we work on. As board members, organizations might be at different stages in the journey around something like community investment. I think it's important to realize that as board members, we can play an important role, both in understanding where the sort of initiative is at, where it's going forward, reinforcing its strategic importance. So there's a critical role for governance around initiatives like this that have a goal to really create more resilient communities and to establish projects, initiatives that are sustainable over time.
As that understanding of the fundamental connection between living conditions and quality of life and health status and subsequently health care utilization, as that understanding has built in the healthcare community, it simply makes sense to look at ways in which hospitals and health systems can support, usually on the front end of these efforts, providing low or no interest loans and as well as often providing grants at the pre-development phase of these kinds of investments to help when there's not a funding stream to help support improvements.
The first would be start small. That makes sense. Go ahead and gather that experience and work forward. The second would be, it's almost a cliche, but it really is critical to start by listening. And so listening to the community to really understand what those needs are, I think lies at the heart of it. And then working and taking the time to really identify partners, both in the community who can guide you and those partners that you can work with as you think about investment and sort of growing the circle of partners working together is key. And then perhaps also sort of from the outset, rather than this being a standalone, or think of it as part of a broader strategy to impact the health of the community. And I think framing it in that way is important. At Common Spirit Health, we like to think of it as one of the threads that we use to help to improve community health. And hopefully what we're doing is weaving a fabric with others that helps to really address key fundamental issues in a way that grants and other things can address, but this investment helps to hopefully lay that sustainable foundation for raising the health of the community up as we weave these threads together into this enduring fabric.